Hello, and this is Dr. Corey King from AskDrKing.com. I specialize in working with patients who are struggling with chronic health conditions, especially autoimmune patients. And recently I was invited to a thyroid support group on Facebook. And I just went on there, introduced myself, told them what my fiance Natasha and I have been through with our health experiences, with her Hashimoto's disease, with our mold experiences. And one question that a lot of the members on there were asking me is, yeah, Dr. King, how do I know when my health condition started? Because what is happening with a lot of these patients, they're having these symptoms for many years, but every time they go to the doctor runs their blood work and says, well, I'm sorry, Mrs. Smith, your blood tests look normal. But Mrs. Smith is turning around and saying, but I don't feel normal. I can't gain, or excuse me, I can't lose weight. I can't sleep. My energy is down. I have brain fog. My joints are hurting me. When I exercise, I don't feel like I'm recovering. Maybe she can't get pregnant. Whatever the symptoms may be, a lot of these doctors still turn right back around and tell these patients, well, why don't you try to exercise, eat healthier, and decrease your stress. A lot of those patients have already been doing that. They've already researched. They pretty much have a good idea of what is going on, only for the doctor to turn around and say, it's all in your head a lot of the times. Let's put you on an antidepressant. And yesterday, I was just answering some questions from some of the members on that thyroid support group, and that's what a lot of them were sharing with me. So I want to explain the difference in ranges when it comes to blood tests, because this is going to be really important when you get your blood work done, because if the doctors come back and say, well, your blood tests look normal, you're now going to be armed, if you will, with the knowledge of, yeah, but your ranges are pretty wide. So meaning, when you get blood work done and you get the results, you're going to see the results on one side, and then you're going to see this reference range or a laboratory range on the other side. Where do they get this range? Well, if you think about the people that typically go in and get blood work done, it's mainly the sick population. It's people that have some type of health condition, something is going on. You don't get a ton of healthy people that go in there. Now, granted, some of us healthy people, we do. We go in, we get our blood work checked yearly, sometimes biannually, because we want to know how well we're doing to improve our health. But a majority of those people are sick people. So what happens is the Endocrine Society, they take that data per region and they come up with a bell curve. So a bell curve, essentially, it's going to look like an upside down horseshoe. And unless you're at the extreme high or you're at the extreme low of that bell curve, they tend to tell patients, well, your blood tests look normal. Okay, because keep in mind, they're comparing you to all these sick people, so that range is rather wide. So when I look at blood work, we look at what's called a functional range. I just call it the healthy range. And what that means is it's just a tighter, more optimal range. Once you start going outside of this tighter, more optimal range, and let's just say right in between here, but the lab range is starting here. So if you're falling outside the healthy range, but you haven't gone outside the laboratory range yet, the doctors aren't going to see that on your basic blood test. Okay. This is why when a patient contacts me and they say, hey, Dr. King, I've been to the doctor, they tell me my lab tests are normal. That doesn't mean anything to me, because the doctor's normal versus my normal are going to be two different things. So I'll put your blood work into our software program. It's going to print out the functional and the laboratory ranges, and we're going to look at both of them. Okay? If you're outside the lab range, that's bad. I mean, that's sick. We call that the sick range. Typically, that's medication, that's surgery. You start going outside the functional range, well, we can catch things before they become a big, big problem, but that's also where your symptoms live. And this is where the frustration happens with patients that are going into doctors only to be told your blood tests look normal. Okay, so I hope that kind of sheds some light for some of you that may be going through this right now and are starting to lose hope and starting to give up. So don't lose hope. You just need to find somebody that understands looking at blood work at a little deeper level. And if you don't have somebody near you, contact me. I work with patients remotely all across the country. I work with patients domestically and internationally. So we can help you regardless if you are in Austin, Texas, Orange County, California, or in Thailand. I have some patients in Thailand, which is pretty cool. Alrighty, so if you want to learn more information, visit our sites, AskDrKing.com, Facebook fan page, Ask Dr. King, and our YouTube channel, Ask Dr. King. Until next time, we'll see you then.